First tonight, call it a flu shot fight. One woman's refusal to get the flu shot could cost her her job. It's one of two big stories on the flu, both seasonal and the H1N1 strain. We start tonight with 24 Hour News 8's Tony Tagliavia live at Spectrum Health, where a controversy is brewing over the seasonal vaccine. Tony?
Good evening, Brian. A part-time respiratory therapist who works at DeVos Children's Hospital here at Spectrum's downtown complex says she doesn't want to get the seasonal flu shot for religious reasons. That's butting up against a new policy requiring all workers at Spectrum to get the vaccine.
And then in September, they sent out a letter stating to us that we had until November 30th to be in compliance and to get the flu shot. They said that we could sign a medical exemption waiver.
Rachel Denherter decided to fill one out.
Submitted it, based it on my religious beliefs and First Amendment of the Constitution, freedom of religion. And I got an email back from them saying that no, they weren't going to accept that as a reason.
The reason behind her reason?
I was raised a Christian, and it was my belief that I feel like God created us in His image. He created our body and created our immunity.
And she says she doesn't want to put anything into her body she considers to be toxic. The wider medical community sees vaccines as life-saving. Tens of thousands of people die every year from the seasonal flu. Protecting patients is why a Spectrum Health spokesman says the system is now requiring all employees, full or part-time, to get the shots. The flu shot requirement coming in part because of support from the Infectious Diseases Society of America for universal flu vaccination of healthcare workers. Does the hospital have the right to require this?
Well, they really do. It's a contractual right. And again, I haven't actually seen the contract, but most of these contracts say that we can change the policy at our discretion over a period of time.
Cooley Law School Associate Professor Kurt Benson says beliefs often conflict with laws and policies. He says you have to weigh the interests. In this case, one person's religious beliefs versus a wider patient safety concern.
Ultimately, the final arbiter, unfortunately for her, is the employer. And they're going to say, we respect your beliefs, but our responsibility to our patient is paramount, and therefore we're going to err on the side of the patient and not you.
Denherter says she and her husband are prepared for the possibility that she'll be out of work by the end of the month.
I didn't feel like I wanted to be bullied into getting a shot. It's a disappointment. I'm not sure if I'm ready to give up on my career. I love my job. I love what I do there. It brings me great joy, but I have to take a stand on what I believe in.
She told us she believes she's speaking on behalf of other employees at Spectrum who don't want to be forced to get this shot, but fear losing their income, and so they aren't speaking out themselves. Now, she tells us she did get the other vaccines required by Spectrum because she was vaccinated as a child. We reached out to the ACLU to talk about this issue. If we hear from those representatives, we'll let you know what they have to say. Live at Spectrum Health in downtown Grand Rapids, Tony Tagliavia, 24 Hour News 8.